Hi, I'm Avi. All right. You can sit.
Do you want shorts?
Yeah, hold on. Let me just read this first and see what's going on. Chronic pain syndrome.
That's what they've told me I have.
No scan?
No scan.
Oh, because it's neck and back pain. Okay. So you have neck pain and how far down? Okay, so across here and
You
where
can
in the
put your
neck?
hands
Pretty much from there to there.
Oh, okay. More on the spine? Okay. Okay.
Let's transfer out to my sort of front thing.
Okay, and then bronchitis, age 17, 18, age 20. How long do you have it?
What, the back pain?
Yeah.
Since I had the car accident.
Okay, so age 20, she had a car accident causing low back pain and neck pain, and IBS started. Were you rear-ended?
No, front.
Front?
So it hit the front of the car. It came around a bend too fast and hit the front.
Oh, somebody, okay, so it came
Whiplash
sort of from the
injury.
side. Somebody came and turned into your car.
It came around a bend and hit the very front of my car.
Right, so your car swiveled to the left or to the right or something, or?
I can't remember, it's more that sort of front
Oh,
back
it's-
job,
okay,
really.
okay. So
it's a
it
whiplash
sounds almost like,
injury.
almost like rear-ended, okay. And so IBS started with that car accident.
Within that year, yes.
Interesting. Pelvic,
Gap pain.
what do you
So
mean by
people
that?
call it all kinds of things, pelvic gap pain. So in my pregnancy,
Mm-hmm.
I lost my mobility. So I lost all the stability around my pelvis. Some people call it pelvic gap pain, some people call it, yeah.
Okay, hold on. You lost your mobility?
Yes, I did. I was on crutches and in a wheelchair for nearly a year when I had my first
Well,
child.
okay. Because of pain, or you lost the mobility?
It was a combination of the two. It's pain and you lose the stability in your pelvis.
Okay. I think I understand. Okay, and then you have chronic fatigue. Oh, both pregnancies caused it. Okay. Severe back pain. At age 45, she had severe back pain and neck pain.
That's when I started seeing Nick.
Oh, so, okay. Cramp at night in calves and bottom of foot. Continue, then age 47, which is now. Is that what it says? Now?
Yeah.
Continued back pain and neck pain seems to alternate. Cramp has improved. Okay. All right. Mama died of ovarian cancer. Okay. Okay. How are you? Do you still have periods?
No, not currently.
Okay.
Hooray.
When? Wow. Tell us about tell me about Hooray. What was wrong with the period? Why didn't you like them?
They were.
Does anybody woman like them? Yeah, you'll be surprised.
No,
Someone will really do.
When it comes to fertility, I'm sure they do. But mine were very irregular, a mess, even on the pill. So I stopped taking the pill about 2 years ago.
And then they disappeared altogether.
No, they just stopped this year. Just the
Okay.
beginning of this year, they've stopped.
So they were always irregular.
Always.
Okay, yet you didn't have a problem getting pregnant.
No, not till that was easy.
Okay, it was only pregnancy wasn't easy. Okay, and then besides irregular, was there any pain? Was there anything?
Yeah, always had clotting, cramps, long periods, lots of blood.
Okay. Let's.
Just one more thing, Anita. Did the instability of the pelvis, is that a family thing? Did your mother?
My sister had the same problem. My mum thinks she probably did, but obviously the era she had her children. It wasn't acknowledged or recognised.
I think, I don't know, I've never heard of the symptom before, but my thinking is you're pregnant, it's some hormone component that affects the bones and the ligaments. Okay, and therefore there's no stability.
Softening of the pubic symphysis.
Yeah, but that's supposed to happen at the end.
Yeah.
You know, it's not supposed to happen, so
Yeah,
it
it is
happens to them
pathological
more
already.
extremely.
Yep.
It happens too fast for them, is
Yep.
my assumption. And then, so
And too
therefore.
extreme.
that's why I'm asking her about her periods.
Mhm.
Okay, that what else, you know, like, and she clearly didn't like her period. I mean, this is clearly something not so overly happy. I mean, no, you know, I hate to tell you, well, I don't hate to tell you, there are women who love to talk about their periods. They can sit in a coffee shop and discuss periods all day, you know. It's like, you're like, what kind of conversation is this? All right. So just my assumption is there's a good possibility that this is actually an endocrine disorder that's manifesting as back pain. But I don't know yet, so we'll find out.
I think the sacrum will probably confirm that.
The sacrum can confirm.
Yeah.
Well, but her other part is this, so it, you know, I need to confirm both, you know, as a root as opposed to just one. Yeah.
The length of time on the pill in total?
Yeah, how long have you been on the pill altogether? You stopped 2 years ago, but how long were you on it?
Oh my god. Well, apart from pregnancies, obviously, probably about
A long time.
25, 23, 25
Lovely.
years. Yeah, great, isn't it?
Yeah. Well, yeah, except in case, so, now, okay, well, hold on. You were, age 20, you had a car accident. Were you already on the pill then?
Yes.
Okay, but you had just started. it
Only
sounds
just, yeah.
Okay.
Probably about a year.
Okay, so I'm taking the pill and getting a car accident, so my pituitary can totally get messed up. So, all right. No, I just wanted to know what, you know, because then it's hard to say, is it possible that having taken the pill created a certain weakness and therefore the car accident had a much stronger effect on her? You know, I don't know yet. Let's have your socks
Do you want socks off?
Do you have
I have
shorts
shorts on
underneath?
underneath.
That'd be
Wouldn't that be
perfect.
easy?
That'd be
And which
easier.
way round do you want me? On my back, I presume?
On your back, face up. On your back, head here.
Be interesting on my back.
We expect miracles here. Anything can happen. By the time we finish with you, you'll be able to go sideways, whatever. Can I switch? Can I pull the? Yeah, because she's hyperextended within the knees, and that's going to be less comfortable. So you also have very loose ligaments in general.
I do.
Yes.
Not as loose as some, but yeah. My chiropractor used to call me bending.
Okay. Yes. All right. Nick, always rapid?
Didn't really stand out.
Are you scared of him?
No, I was scared of not finding him in time.
Oh.
That might have been chatting around Reading. That might be it.
Oh.
I'm sure it'll come down.
Take the pillow slightly more. Is that more comfortable? Gonna poke belly. You know the routine because you've been treated by Nick. All right, so when I press here, that's just my fingers,
Yeah.
correct?
Yeah.
Okay. No more IBS or yes?
I still get IBS.
Okay. So when you say, just so that I understand, IBS means to you constipation, diarrhea alternating, and
Yeah.
cramps?
Yeah, and lots of wind. I'm warning you.
Let me get the mask. And that started also age 20.
Yeah.
Never had a problem before.
No, I don't think I did. No.
Okay, so that's possibly more related to some L5 situation. I know you're saying your pain is more down here, correct? But how about
Oh, that's always tender.
that? Okay,
Yeah.
this is tender. Okay, because you showed me more the sacrum, but actually
Yeah.
L4, L5 is.
Yeah.
So when I press this tender,
Yeah.
clearly.
Yeah.
Okay, thank you. All right. Anything here? She has a
Yeah.
Ren 9 pulse. I can feel it on the ketsu already. So she has a ketsu. How about right stomach 26? Yeah, more,
Yeah.
worse.
Yeah.
Now it's interesting because that side feels a lot softer than your ketsu. That has happened to some people, especially her type. That's kind of like the loosey-goosey ligament type thing. No, you know, like some people you press on the abdomen, it's tight. Like you're a tighter type, okay? It's like especially, you know, you press on her and you go, wow, how can she say pain? It's like margarine, you know, melted, but that's when they feel. Whereas other people feel when it's tight, okay? How about 4 o'clock,
That's fine.
8 o'clock?
That's okay.
Okay. Ren 9.
So,
Okay. Do you feel your pulse when I press here? Do you feel?
Yes.
Ooh, okay.
Yeah.
How's Ren 12?
That's okay.
This is from the car accident?
Oh no, that was a dog bit me. 2 years ago, I got bitten
you
in the
bit
face.
too?
Yeah.
Wow. What kind of dog?
A collie cross. A patient's dog.
Ooh. Why?
14 stitches. I was very lucky.
I'd say. Anything here?
Nope.
Here. Okay. So, oketsu and right stomach 26. Okay. And then uterus, ovary, and uterus on the side, and ovary on the side. All right. So just oketsu. Okay. How about gallbladder 26? Gallbladder 26. Seems like nothing.
Okay.
Okay. All right. It's okay. 1, 2, 3.
Or slightly 3.
Slightly 3. Okay. 1, 2, 3. Okay. How about the scalings? 1, 2, 3.
1 and 3.
1, 3. How about 1, 2, 3. 2 clear. Okay. Not more.
Yeah,
Okay.
2.
Anything here? A little bit compared to, yeah. All right. Now, you say it's the neck. 1, 2, 3, 4, 5.
1.
1. Okay. How about here? Okay. So she has at the very top, do 16. Okay. Now I'm going to the side. My side. 1, 2, 3, 4, 5, 2.
2, 3 and 4.
Oh, 2, 3, and 4. Okay. So 2, 3, and 4. Okay. And the right side. 1, 2, 3, 4, 5. 4 and 5. Okay. So let's take. Okay. Any discomfort here?
Yeah.
Okay. Hormonal. Sorry. Feels bruised.
Yeah.
Okay. This side too.
Yes, not as bad.
Okay. I have to confirm because left side will be related to constipation. Otherwise, both are related to endocrine. Yeah, we can pull her out. Yeah. He has UB35 as well. Okay. So kind of stronger on the left side, possibly because of the bowel issues. Okay. Because colon comes down on the left side and connects with the adductors. Okay, so, but it's going to be more closer affinity to the left side. Okay, so.
So where were you compressing in the
Inner
neck?
ear area. Sorry.
Oh, in the ear. Okay.
Yeah. So now let me check her. I know L for L5 on the spine, but I haven't checked everything yet. And I just checked the neck. But you saying it here also? I'm comfortable here?
Yeah.
Okay, so do 12 also. And how about above?
Not as bad.
Okay, and do not help me.
Okay.
What do you do for a living?
I look up people's feet. I'm a foot health professional.
Foot health professional. Okay. I'm keeping my feet in my shoes. Nobody.
Quid pro quo, or
Hmm?
quid pro quo?
No, not with my feet, believe me.
Oh, nice to your feet.
I'm trying, it doesn't work. 1, 2, 3, 4, 5. Okay, so. Hmm?
5 was
5
so
is,
bad,
oh,
but
okay.
The others.
The others, okay, so below do 12 more. Okay. And then the, wait, don't help. Here, you said before that there was discomfort. 1,
Yeah.
2, 3, 4.
More 1.
More 1. Okay, L5. How about left side of L5? Okay. And right side of L5? Okay. Starting with UB60, see if it's an endocrine issue. Okay. Right of L5 now? Any change? UB66.
Slightly.
Slightly what?
Slightly improved.
Slightly, okay. Good. Bye, thank you.
Thank you. Bye-bye.
So, okay, let's take this one. Okay, it's clear, right?
Yeah.
This clear. Okay. And how is now?
It's better.
How much better? Percentages?
50, 60%.
50, 60%. Okay, fine. And you had discomfort here, right? When I press, how is discomfort? How much better?
80%.
80%, great. And this is the one you really hated. Sorry, I'm pressing here. I'm still on the left side, but I'm checking something on the right side, so I don't know how much effect it would have. How is now?
Yeah. It's improved. Yeah.
Okay, great.
Is that like
Bend-
66?
66, we're still at 66.
I thought it
Okay.
didn't work. Or did you just move your...
Who said it didn't work?
No, well,
Ah,
I
yeah.
thought you did. I'm sorry, I don't know.
We
your
haven't
name.
checked on her yet, anything. This
No,
is the
you-
first thing I'm checking.
Oh, you did bladder 66, tried to catch it, I didn't think it helped.
Yes, it
But-
did. No, you, something got confused here. The very first thing I checked was that, oh, it didn't help, sorry, yes, you're right. It didn't help left side of L5,
L5.
but it helped L5 center, then it helped the kids, sorry, yeah, you're right, there was one thing it didn't help, up to now. All right, you had here, right? Sorry, now I'm pressing, how is here? By how much? 90%, okay.
Where were you pressing?
No, not the 216 yet, cervical, it's on the right side. The top one was the worst. And then here, let me just get my fingers here. Are we talking about here?
Yeah.
Okay, here, okay, that's just one sample, it would work. How's now?
Yeah, it is. It's
Percentage?
better. Maybe about 40%.
Okay, now you also had here, right? You hated this one. This is the center.
Yes.
Yes,
You got it.
yes,
You
I got it, okay. So, how's now?
Yeah, that's
Okay,
Yeah.
great. So, any discomfort here on the stitches? Because UB2 is also hormonal area. Why did Colleen know what her problem is? How does the dog understand? Any discomfort on the stitches?
No, it's not too bad actually. It's okay.
All right, good. Any problem on small intestine 13? Another hormonal? No.
That one.
That one.
That one.
Okay. Could you bend that leg for me? Oh, okay. How's now? Better. Okay. Remember bruise-like, right?
Yeah.
How's now?
Yeah. Better.
Okay. Next, let's check between this small intestine 3 I use for women. UB66 is endocrine. Small intestine 3 is specifically more for pituitary, especially if it was manipulated with birth control. Okay? So, how's this guy now? How's this guy now?
Better, but not 100%.
Okay, that's fair. And it's here? You had a
Yeah.
big one.
Yeah.
Yeah? Okay. Now?
Yeah.
Okay, she smiles a lot. Okay, good. All right, let's start. So it looks like endocrine idea is the thing that makes everything better up to now. So we'll start with that and continue. And see
What about small intestine 3?
What about it? We're just starting.
Oh, is that what you're doing? So you were doing such out with.
No, just one more. Okay, UB66 is for most endocrine, most hormonal. Small intestine 3 specifically if they took the pill. Small
Yeah, I
intestine
think
3
it was
is more.
Fascial.
No. So I would. Small intestine. You okay?
Yeah.
Is there a way you can make your back pain feel worse? Is there a movement that makes the back or the neck feel bad, or?
My neck, yes. If I tip my head back, you know, if you go to laugh, you would tip your head back sort of with subconsciously. Yeah, that is really horrible because it's something that you do subconsciously as well. So I'm
No, of
thinking
course,
about
of course.
it. Yeah, that's really horrible for my neck.
Okay, gotcha.
For my back,
That
it's,
relates to the sacrum, that part.
for
But
my,
go ahead, yeah.
for my back, it's probably bending and stretching at the same time.
The needles are okay?
Fine, thank you.
Okay, you're welcome. Okay, I'm going to ask you to do something a little bit weird. Do not use your hands too much. If you do, use more the thumb area. Don't use this side of the hand. I'm going to ask you to stand up
Okay.
and walk around if you can. It may not be comfortable with the needles. Then point 12.
And then someone tell her a bad joke.
Oh, good. Step on your heel first if you can. Okay. Now, do whatever you need to do to produce pain and tell me where it's at.
Produce pain.
Of course, I want to see if I'm doing well. Yeah, laugh.
It's sort of stretching.
She is hyperbending. You are.
Oh, am I?
It's true.
Okay.
I know for you it sounds normal, but you know for most people, no. She's reaching to the side. She's almost touching the wall.
This is what happens when you go to see a consultant, because you move, because you can move. They go, oh, you're fine.
Yeah, right. Yeah, no, I know what you mean. Yeah, they don't understand that it's
No.
actually problematic. How is that for you?
It's fine. It's fine.
It's
Yeah.
everything is better.
Yeah, I think so. Yeah.
You can use the palm of your hands to push on the table and and just
Get back in place.
get back in place. All right. Okay. So let's see what more we can do.
May I ask a question?
Of course you may.
The relevance of the pill.
Hormonal manipulation.
Yeah. Just that's it. End of story.
Yeah, besides hormone manipulation, the rest is, I don't know what else they put in it, but it's like starch. So I don't think that's a big, yeah, even though we discuss starch, I don't think that starch in a pill is the problem. It's purely, it manipulates your hormones, which means that it manipulates your pituitary, which is the control tower for your, and then it's going to start producing weird symptoms. In your case, it's very rare for someone to say, I had a car accident. And it can happen. I had a car accident, and as a result, I have bowel problems. Now, is it very common for someone to say, wow, I had a car accident, and ever since I have a neck problem? Yes, that's super common.
Yeah.
Okay. Now, yes, if you hit L5, which is how the innervation of the intestine happens, can that affect the intestines? Yes. So it's not like it's totally impossible. But why are you so sensitive to, I wasn't in the car accident, I have no idea what happened, but it would be one thing if you came in, I know it happened 30-something years ago. If you came and you said, and look, half my face is torn off, but it wasn't like that. There's just some internal thing that happens. And so you could have had some sort of weird concussion as a result, like the head's moving and your pituitary was affected. But the birth control pill also does that. So I think you had a predisposed weakness as a child, right? Because mama had the same, your sister had it. So you have a genetic disposition for this.
Right.
So you have a weakness in this area, then car accident comes and sort of whams, into that weakness. But taking birth control is also tapping into an area of weakness for you, and that's one of the problems with birth control pills. I'm addressing all of you actually. is that some women take birth control, it's like, hey, listen, you know, he's cute and he's cute and he's cute and he doesn't like condoms, so, you know, so I have to take the pill. But lots of women take the pill precisely for the same reason that you do, is because of regulating period or pain period and stuff. So that means you already, the ones who says, well, I have 6 boyfriends and blah, 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 therefore, no, I'm making it, you know, therefore I'm taking the pill. It's fine, no problem, you know, I mean, you know, but they don't have a weakness. You know, the women who take pill for medical reasons, they already have a weakness in the exact place where the pill is gonna, you know, hit them. You know, the problem is we don't always have any other solution for them, so they have no choice. They have to take the pill because the pill is the only thing that solves the problem. You know, but it's also weakening their system further, possibly. So, you're welcome. All right. So, how's the boozy feeling?
Oh, that's better.
Okay, good.
Yep.
Anything left on this
Yeah, a
side?
little bit.
Okay. No, that's fine. And how is small intestine 13?
Yep, that's up.
Better? Is anything left?
Still a little bit.
Okay, just 1 second. So, sorry, I will make that better in a second. How's the top?
Yeah, that's better.
Okay. One more. Okay. Any discomfort either here or here?
No.
Do you tend more towards diarrhea or more towards constipation?
Constipation.
Constipation. Anything here?
What's that?
Stomach for, okay. For constipation, I check stomach fire and gallbladder fire, both sides. If I don't find, I'll just do metal water of stomach on the left and metal water of gallbladder on the right. For diarrhea, I check spleen and liver. And I'm using the same idea. If I don't find them, if I find them, I go with the metal water. If I don't find them, I'll do spleen metal water on the left, liver metal water on the right.
Sorry,
But I want to know, oh, okay,
It's
too
quick.
Okay,
Too quick.
Okay. So I'm going to slow me down if you say 20 times. I understood, it's too quick. Diarrhea. Okay. IBS is a combination of diarrhea and constipation plus cramping. Okay. For the diarrhea, I'm looking for spleen and liver fire points. If I find them, I use the metal water according to what I found. If I did not find fire points, okay, of spleen and liver, I will use spleen metal water, spleen 5 and 9, on the left side, and liver metal water, liver 4 and liver 8 on the right side. That's for diarrhea. For constipation, exact same thing, except the young organs, paired organs. I check stomach and gallbladder metal fire points. If I find them, I act accordingly. If I don't find them, okay, I use stomach metal water 44 and 45 on the left, and gallbladder metal water on the right. Same idea as diarrhea, same elements, but different, you know, the young channels. Make sense? Yes? No?
Stomach on the left.
Stomach on the left, gallbladder on the right. Just like I did spleen on the left, okay? So, nothing here and nothing gallbladder. Anything this or this. Anything here or here. No, okay, perfect. No problem. So we just go with a dogma. So we want to know, you have this, you said when I press here, you really don't.
Yeah.
Okay. And by the way, I'm sorry, just need to make sure that this is okay now? Okay. And she still has the red 9 pause. I still need to address that. And this is still little. Okay. Since I'm thinking of doing liver on the right side, let's see if liver 8 will. Gone? How much is left? 10%. And boom. That's better. Okay. So both spleen, you know, I'm basically confirming what I'm about to do. Spleen 9 on the left improves right side stomach 27. There is no relationship between them. The relationship that stomach 27 on the right has to do with digestion should relate to right spleenine, not left spleenine. Okay? So, spleen 5. Plus 9.
So
So spleen 9, watch what I'm doing. I'm going parallel to the skin and up towards inner knee eye. Okay, it's not this way, it's this way.
So obviously it tested well, Avi, but what? But she was more of a constipation type. So why are we doing the spleen?
Well, she's both. So
Oh, she's both.
if someone is both, you're always going for the yin side first. You're always going for the deepest possible.
Sure.
So, and if these wouldn't have proven, then I would go for the for the stomach and the gallbladder. But basically, my main point is to see how can I confirm. So now with these, I can't ask her to. Now I can't see how much better is it for the back because I can't. With these, I can't ask her to stand. That's a bit much, you know. How are we doing?
There's just a niggle there, but it's much better.
Okay, there is a what there?
A niggle.
A niggle.
Slight.
Okay. It's an expression I haven't heard before. It's always interesting to. How is this one?
That's
Still painful?
Yeah.
There, okay, no. Oh, you heard, okay. Oh. How is niggle?
Niggle's good now.
Niggle is
Non-niggly.
good, not niggly, okay. And so mushu, okay, because she has a renine pulse.
Was the reflex the lung and immune though?
Yeah, the pulse doesn't disappear in a second anyway. So, so it's not very useful to check it against the pulse itself. So I check it against whatever else there is. But somewhat better. There's still, I still feel your pulse. Okay. How is this still? It hasn't helped? Hold on. Hmm?
Sorry.
No.
It's easy.
It's easy?
Yeah.
Okay. Because I want to do this one because it's hormonal. Plus it's part of motion. Remember, you open kidney 6, you feel inner yin to lift. Okay? She had this situation where she couldn't lift. So I can say, yes, it's endocrine, but this actual symptom is what? The actual symptom is there is no cohesiveness, which is what mushu is all about, right? How is that? How much is left? 20%. 20% I can do. Yeah.
Bladder 66 helps again, though, right in the beginning, I think.
I do, to some extent, but, well, no, it helped this thing when she said, but when I wanted to needle and I was really pressed, then she went, oh, wait a second. So,
So you don't needle if it's tender.
if it's tender, if it's a teeny bit, it's not the end of the world, but if it's really tender, which she did say, I prefer to release first.
As it applied to all the points that you
Yes. Yeah, at least theoretically. You listen, like everybody else, sometimes it's like, screw this, bang. No, because sometimes you run out of ideas, you kind of like, okay, I don't know what and I need to do that. I think I need to do this point, I'm gonna do it regardless. So it's not the end of the world, right, every so often. But, as a rule, or as a guideline, I say don't needle into pain. Are you comfortable?
I am, thank you.
All right, let me just make sure I didn't leave any symptoms out.
You need only the right
Oh,
leg.
you had cramps.
Yeah, that has improved a lot since I was seeing Nick.
So no cramps?
I get it occasionally, but it has improved immensely. So I was waking me every night. Very occasional now.
And the cramps are in the calves?
Yeah, and across the dorsum of the foot.
And by the way, she says she had bronchitis, age 17, 18, which means before she took the pill and before the accident. So let me just check if there's anything that needs to. 1, 2, 3.
3 is the worst.
3 is the worst. Okay. How's now? Lots better? Gone?
Pretty much.
Pretty much, okay.
Sorry, where are you?
Lung 5, sorry.
Not
Because she had bronchitis and she still shows in the body. So you see, there's a medical history, there's a finding still in the body. So that should be addressed. If I find nothing, I don't go for lung 5. But,
Do you palpate the kidney line?
sorry?
You have pathetic.
Pathetic lung capacity.
Yes.
Well,
I'm not
there is a
excited.
there's something a little sunk here, I think, so.
What did you press on the chest?
Kidney line, kidney 26, 25, 24 kind of area. Bronchial reflex. Is, how about 1? Ooh, okay. 1, 2, 3. 1 and 3, okay. House 3. And house 1. But there's
Still
one is
there,
unhappy.
but it's better.
Hold on. Did you break the collarbone when you in the car accident?
I broke my collarbone when I was about 2 years old, but I don't know which one.
Chances are it's this one.
It's interesting, isn't it?
Because, well, no, because this is the painful one.
It's a long, long, long time.
Okay, hold on. Let's see what I can do to fix it.
You know, I broke my collarbone. Let's go.
Well, I didn't know, I asked, wait a second, I'm not promoting the idea that I knew
like
anything.
You.
No. So,
My mum's not here to ask.
yeah.
She would have been. My dad would
This
have been,
one's,
what?
well, actually, you'll be surprised that 40-something years later, your mom would probably, well, I remember something, I don't remember which side, darling.
Probably.
This one's okay now?
It's still tender.
How's that? How much is left? 10 is okay. 10 I can live with. Well, I hope you can. Okay, but this one's still there, right?
That one's better too.
Oh, it is better.
Yeah.
How much is left?
Well, that's fine.
It's fine.
Okay,
Okay,
yeah,
so
that's
maybe it
good.
wasn't the collarbone. No, okay. If they have collarbone, you can go small intestine 10, or, this area here, and needle inwards towards the
If they have a
scapula.
collarbone, like
Collarbone problem,
Problem,
yeah,
yeah.
because collarbone doesn't heal. It's like, because they can't cast it. What are you gonna do, and they can't immobilize it because every time you breathe, the collarbone moves. You can't just kind of, first of all, there's nothing to cast it on, and then on top of it, you can't make the person only breathe below the nipple. It's not gonna happen. Okay, so once the collarbone's been broken, and by the way, same thing with the tarsals, the these tarsals, phalanges, whatever these are called, in the foot, because there's no way, that you can't immobilize them.
Is that the same with the tailbone as well then?
Yeah.
Not sure. I think, well, the tailbone, yeah, it can
Because
be
you can't
immobilized.
set it.
Yeah, but also the tailbone isn't attached to, well, it's attached only on one side. It's a very weird bone, isn't it? I mean, it's kind of like tailbone's a hanging bone. I mean, just like a rib is, or some ribs are. Okay, if you do, ribs are very difficult to clear. The best thing for ribs, fractured ribs, is to do direct moxa on the rib, on the place. Now, obviously you don't do it the second day after the injury, but once it's kind of relatively healed. The other thing is for ribs, I do liver 4, lung 4, My lung 4 is, you bring the nose to the, not the TCM thing of this is lung 3. If you bring the nose to the arm, it's lung 3. If you bring the arm to the nose, that's TCM. Yeah, it's totally different. It depends on which one you move. So you bring your nose to the arm, that's lung 3, but you don't have to do that with patients. All you have to do is slide up and you'll stop at the edge of the brachialis of the, is that what it's called, the muscle? Brachialis, yeah. So that's our lung 4, which say it supplies oxygen, better expansion capacity in the lungs. Okay? You comfortable?
Yeah.
All right. Any questions?
Yes, sorry, I miss a little bit of the connection with the colon with this inner side. So,
Who said there wasn't?
no, the standing colon to adductors?
Okay, down the collarbone? No.
No, sorry.
Colon.
No,
Colon
but
and the
that's
adductors.
yeah,
Okay.
no.
The
Going back to
collar.
the beginning of the treatment.
Yeah. Well, beginning of the treatment, I didn't see the bronchitis at age 17,
Yes.
18. After, when we finished the treatment, I wanted to make sure I didn't miss anything, and I saw she said she had bronchitis at age 17,
Yeah.
18, which is before everything. So I checked kidney line, which
Yeah.
reflects bronchitis. One side, kidney 27, was painful, and it wasn't going away with lung 5, so I thought maybe that's the side she, and then she said, oh,
Yeah.
did you break the collarbone? Because it's like, why is it so painful? But lung 5 actually did clear it. There is no connection in the collarbone and inner ear.
Okay, but separate. Yeah, I got that. But when you were palpating, so the inner yin.
Yes.
So you were mentioning the connection with the adductors, adductor pain
Yeah.
and the descending colon.
Yes.
Yes.
Yeah.
So which reflex do you? Well, just tell me.
Which okay, just tell me about it. Okay.
Whatever, yeah.
Okay. The descending colon, the colon, and the adductors are one fascial plane. The continuation of the descending colon. If you look at the muscles here, they attach. They have to attach into the body, and so they're attaching where the descending colon into the colon, basically around where the rectum is. There's a continuation of the line between the adductors and the colon. If you want to affect the colon, you can affect it from here,
Right.
okay, from inner area. Now, it's going to be, the effect is clear, there's a clear connection on the left side because the colon descends on the left side. Think of this as, this is a trigger point for the colon.
Right. Okay.
Because, trigger points are usually on a muscle that is adjacent.
Yeah.
Okay, same kind of deal.
Cool.
Make sense?
It's not quite connected, but it's loosely car accidents. One of my patients, so that was more like a classic group, but one of my patients, she had, it happened when she was about 12.
Uh-huh.
So she said she never broke anything, but she was immobilized post with bruising, totally black for the whole of the front of her thigh.
The whole front of her
Upper
thigh?
leg.
Okay.
Upper leg.
Thigh, okay, I know that word.
And, but the big thing that came out of it was that her mother, who was the front seat passenger, became a tetraplegic from that accident. And lived a long life as a tetraplegic kind of thing. The dad, who was a driver, nothing happened to. And
Where was she sitting?
she was sitting in the back, but I can't remember if she was behind, which one she was behind.
Yeah, I mean, I do think it would be.
But I think her leg was up, she was saying to me actually, her leg was up on the back of the seat, on the back of the driver's
Yeah, I
seat.
understand.
So, but she was lucky in a sense, no fractures.
Yeah.
But to me,
But
I
she
mean,
was immobilized.
she said, as a 12-year-old kid, that initially, because of all the bruising was just so painful or whatever, she just remembers that she was in bed, for a week or two.
Okay.
And that was, Now, a 50-year-old woman comes in, upper spinal, going across shoulders, round her gallbladder 20, and lower back. But her big thing is this stiffness. So she I watch her when she's coming to clinic. She's like an old deer getting out of her car, excuse and you know whatever, but she's just so slow, and she's 51.
Yeah.
Kind of thing. My thoughts now doing this is kidney, like because of that, because of what happened to the mother.
Well, yeah, I mean, well, the thing is, well, the things that are clearly not applicable, you know, between her and your case is the hormonal component.
Yeah.
I think two things. What you have to look at, a child at age 12 that goes through this kind of accident where the parents are involved and the mother turns, tetraplegic, or, you know, and she was immobilized, you know. You have to look at the idea that, you know, there is a huge, huge shock.
Yeah.
Okay, so that should put her into the adrenal category. Whether she's going to show adrenal or not, you could probably use adrenal treatment and try and. Now, are you saying, you're not saying she's bent over though?
No,
You're saying she's walking, she's just very tight.
Just everything, yeah, very tight, and
Yeah.
she, you know, she gets off the bed and we've had we're going to use another methods because this is new to me.
Yeah.
So we get some improvement. She gets off and is more mobile at the end of treatment. But you know, a week later she's coming and she's getting bloods done now because I said to her, so please get them to do some screening for like autoimmune. I think it's a, you know, whether there's something autoimmune going on as well.
Yeah, it's very hard to know, but I would, you know, is how related it is to that car accident. It may well be related to the car accident, but then I would have to look for clues in the body to see. The one clear thing for me is that, you know, from the story is that there's very good possibility of adrenal shock. Meaning, look at adrenal treatment, either kidney 627 or kidney 727 or one of those. You know, if you're asking me, do I think Mushu helps, the answer is always yes. So it's just something that I constantly use. And I would look at Sanjiao, either, you know, if rapid pulse 5, but if regular pulse 8, and see what you can do with that. Other than that, I'd have to have a little bit more history. Now, if, you know, because it's hard for me to, okay, if it's tightness in joints we use the spleen. Okay, so spleen 9, you know, if it's muscular, we use spleen 3. If it's tendons, we use liver 8. So there's many ways to try and cut this cake, sort of thing.
She was a tennis player up until 6 months ago. So she's
Oh, so this
been
was
active.
sudden?
Yeah, she's been an active person. And she denies, when I just asked how did it feel back then, well, you know, it was horrible. You know, you think, God, if you know, it was me, I'm like, God, it was really
Yeah,
bad.
but you know, there is one more option from what you, so this is a fairly acute onset. Did it happen kind of suddenly?
She thinks she had some kind of a weird tennis incident, but not like a, oh, I did this with a tennis movement. and then-
No. The onset, the onset is clearly in the last 6 months. Okay.
Yeah.
Did it happen overnight, over a week, over 3 months? Is it progressively getting worse?
Progressively getting worse.
So it started teeny bit?
Significant, but getting,
Okay.
yeah.
Yeah, I would look at possibility of infection. Not necessarily just autoimmune.
Yeah.
Because there is, you know, just like you have, you know,
Like polymyalgia.
well, no, that's not what she's describing. No, but you have, people have, what do you call it, numbness, yeah, you have viral neuropathies and stuff that come like that. So I would look at something like white blood counts and stuff just to find out if there's some possibility of some infection. I don't know. Sorry.
No.
Yes.
You mentioned that for ribs, the best treatment is direct moxa on the
Liver
break,
4, lung 4, and then direct moxa on the pain,
on the pain,
will be usually.
where the break is.
Yeah. Sometimes they'll be referred somewhere else.
Thank you.
You know, like, what, how come you wouldn't think more to do with the liver? You know, we were talking about my patient with the hypermobility, sort of the ligaments of the shoulders.
Oh,
Like,
okay.
what would steer you not more towards that? obviously the hormonal kind of did it all, but would you then explore that?
No, well, we do have, I mean, the ligament points are liver 8. Could I do one more on this side? I could. Given that I have inner yin and liver 8 are very similar for me. I mean, yes, liver 8 is definitely much more of a tendon. Yeah. So I did the tendons on more right-sided, granted. So,
But how would you not, how would you establish that that kind of wasn't more the root of it than the hormonal?
oh,
Kind of like,
well, then you would you would see if liver really did, you know, the loose ligament type, it's both a liver and a spleen type. The tight ligament type is definitely a liver type. Okay. But the overly loose, because it's not just ligaments that are loose, it needs some cooperation from the rest of the fascia to be that loose. It's not a pure, see, the people who are tight ligaments, who have hammer-toed, for example, or something like that, that's liver not nourishing, the liver blood not nourishing the tendons, quote unquote. Therefore, the tendons are too tight. The ones where the tendons are too loose, there's a lack of control, and that lack of control is not just because the liver, which is officially responsible for tendons, but it's also what's the rest of the surrounding tissue doing in order to let this happen, to like flop all over the place. So they tend, because you know, you can't just have loose ligaments. You know, you can't be, what was Wendy?
Okay, well, Wendy,
Yeah. You can't be that, you know, hypermobile if just your ligaments are loose without the muscles being willing to stretch out also. Okay, because if you're just, let me just see if I can, okay, if it's just the ligament is too loose, what's going to happen is you're going to be able to I can't do it obviously because I don't have that phenomenon. You're going to be able to dislocate your shoulder, you know, you're going to be able to do weird things with your shoulder, but you're not necessarily, you may not be able to lift your arm up because the fascia isn't willing to do it, but you're going to be able to torque weird things around as long as the fascia is not stretching too much. Okay, so the muscles, in order for someone to be like really bendy, like really all over the place, like, and spread, you know, like with the legs all over the place, the muscles also have to be willing to do that. It's not just the ligaments are not holding, it's also the muscles. She, you know, so that her type, the overly loose, tends to be a combination of liver and spleen and not just liver. The tendons too tight generally is a clear liver type. Make sense?
Yeah.
and so then obviously, say in the patient I was talking to you about, he's sort of got both. He's got hammer toe, like scrunched up toes, but then the ligaments and shoulders were all too loose.
Oh, I didn't realize that. Okay, I
And
thought.
it's like
Oh,
that kind
okay.
of would be more the liver spleen then, having to have the ligaments shortened to hold it in.
Presumably, yeah.
Kind of two different, not necessarily completely related then. I
No, they are related.
But different.
But, well, he can have both, and but it's just interesting that the liver would choose to be overly loose in the shoulders and overly tight in the feet. That's
So you might then think
interesting.
the loose
Then I
shoulders
need
could be
to,
something different to the
or something's. You have to look at what's the state of the liver and what's the state of this person in terms of upper, lower. Maybe they have a discrepancy. That's in between what's going on in the lower body and what's going on in the upper body. I don't know. That, you know, but it's an interesting idea, that because I've never really looked at someone who has, on the one hand, very, very tight ligaments, and on the other hand, overly loose ligaments.
Yeah.
You know, and that there's a clear, you know, plane of loose and a clear plane of tight. So that sort of brings it possibly to a whole different place that I don't know what to imagine on.
Yeah.
So,
Okay.
yes.
I've got a patient who is quite a complicated situation. I've only seen her a couple of times. And her main thing is this severe pain between T2 and T7.
Uh-huh.
And she's got diabetes and she's got loads of other stuff. And she said that it happened when she bent down and she picked up something heavy and, you know, affected mainly here. Now, we've done various things. I can't remember exactly what I've done, but when we've turned over, the pain has still been pretty excruciating. So at that point, I wasn't checking anything against that. You know, I was trying to clear other. I wasn't doing what you're doing here in terms of checking that direct place.
Always check when you're clearing the abdomen, when a patient comes with a symptom, especially if it's a pain syndrome. Okay, I'll let you finish in a second, but I just want, as a general comment, this is a mistake, in my opinion, that people make a little too often, and you should try and avoid. When you're checking the abdomen, let's say the person says, I have ear pain, it hurts here, okay, and you can press on it or whatever, or they, you know, what you want is everything you're doing against the abdomen, also check against the symptom. It makes it look like we're very symptomatic, and that's fine. And Kiiko hates it when people say, but it's symptomatic. But the point is, because you have 20 different ways to change the abdomen, because you can come and listen to what I'm saying, and it can sound like what I'm saying is, clear the abdomen first. And I've never said it, but it sounds like it. I mean, I'm kind of saying it, but I'm not exactly saying it. I'm saying clear the abdomen first rather than go against the symptom, but don't just clear the abdomen, also go against the symptom at the same time. In other words, say, you know, you're choosing between this and, you know, spleen 3 and spleen 9 to clear the abdomen. I'm just making stuff up here, okay? The best way to do it is which one clears the abdomen and addresses the symptom. Otherwise, I'll choose spleen 9 and maybe spleen 3 was best for the symptom. Okay? So you don't want to clear the abdomen as if it's a separate step from addressing the symptom. So when I'm saying deal with the constitution first, which implies deal with the abdomen first, what I mean is don't ignore it. But don't do it at the expense of, because the symptom will help you determine the constitution also. They're not two separate things. They are in the same body. Okay, so, but I just want to comment on that, but go ahead.
And so this question now is a little bit like, I'm not sure, so turning it over and she's still got terrible pain
Right.
here. Where would you start to try to
Do two.
You don't want to needle in?
No, do 2 is where I would start for that, because do 2 is probably your best bet. Do 2 and or sacroiliac ligament. By the way, check gallbladder 26 on her and check inguinal. She lifted something heavy.
Yeah.
Okay, so gallbladder, inguinal meaning stomach 26, gallbladder stomach 30, gallbladder 27, 28.
So do 2, inguinal.
And gallbladder 26, but the other thing is that you have to consider this.
And she can't lift her arms as well.
Okay, so then maybe,
which
yeah.
I've tried doing that and it hasn't really had.
Okay, if gallbladder 26 doesn't help, look at gallbladder 22, needle to backwards. The first thing you need to look at though, she is a diabetic. The first thing is spleen, so when I'm saying the first thing, don't just quote unquote clear diabetes, because there's no such thing as clearing diabetes, but don't just do it. Now check, what mileage can I get from spleen 3 against the symptom? Forget the abdomen at that point, because you already have, it's not forget the abdomen, but you can totally use spleen 3 against the symptom. Which kidney point do you want to use? And go against the back. Same with immune. See what you can milk out of diabetes. Because diabetes, autoimmune, diabetes, thyroid are so primary, you cannot ignore. Autonomic nervous system, same thing.
She just seems to have everything, so at first
I know, they're very annoying and very confusing.
I did adrenal, spleen 3, she missed the next session because she said she got flu. So I'm thinking, maybe I overtreated her, but this testing against the symptom is the
Yeah, don't just do the abdomen as if it's like a separate entity altogether.
And then you turn over hope that the symptoms got better.
No. Hope is cute, but hope is not where it's at.
Okay, thanks.
So let's just turn it over and you okay? All right.
My sister has no speech.
Yeah, she had a car accident also.
No.
She went to somewhere in Southeast Asia and got malaria.
No.
What happened?
Fell out of a bunk bed.
Okay, same as car accident. No. Okay, spleen spleen is a big deal, but our spleen is different. Our spleen actually has nothing to do with the lymph node here. So it's unfortunately, different. Kidneys, well, you can be missing a kidney, not both, hopefully. So, and yeah, that's a very big deal. Actually, missing spleen is also a big deal. If they took the spleen out, that is a big deal.
Affects her immune system hugely, obviously.
Well, they claim it isn't. So no, because if she fell out of the bunk bed, I guess she was still a child.
Yeah, she was very young. She was 7.
But I think the spleen, the T cells are matured by, I don't know by what age, so maybe she was at a cusp of when it may have been an issue. Because for adults their spleen can be taken out and what they claim is that there is no effect on the immune system. But she was a child, well, because the spleen finishes its official, the education of the cells by a certain age, but I don't know if she was still with, and that may still be an age where it might be important, I don't know.
It certainly impacts on your immune system.
Yeah. All right, so, sorry. If you don't mind sitting up and take a little walk and tell us how it feels, and we'll put your face down.
Thank you.
Sure.
May I have some water?
Yeah, that's fine.
Okay.
Absolutely.
Sorry, Abby, just to ask about that same thing again. So
Are you really sorry?
So say you kind of have managed to decrease it to say maybe 50%. Would you then start needling into the area? Would you use foil? Would you use what?
You can use foil. You can use diode rings with foil. That absolutely yes. That's why the kawaii style is so convenient, is because you can actually do local things that I won't do with needles. So you can take diode rings on, put red and green clips, and put aluminum foil and spark. Yeah, all that. Totally yes, but needling into an area of their complaint is like so not what I do. But no, on the back, if you want to improve that, I would look at sacroiliac, and I would look at DO2. I would also look at small intestine 9-10, for example, and look at T11, T12. Remember, on the back, you always, how does it feel? It's good?
Yeah.
All right. Let's put you face down.
So you're about to say on the back you're always...
I'm always looking at T11, 12, T7, T5, always. Because if you affect those changing curves, the height of the curves, you're going to change everything else.
T11, 12, T7.
T11, 12, T5, T7. Also, heart of soul, you may do as well. She has. So, yeah. Now that we've we may have some hormonal stuff that we're still doing on the back, but we've addressed the hormonal system. Let's see what else, we may be doing more structured, it may be more applicable. All right. So, all right. You described your pain is here, right?
Yeah.
It-
Very tender.
This is uncomfortable?
Yeah.
Okay, interesting. And this?
Yeah, especially on the left side.
Especially on, okay.
Yeah.
So, in L5 very clearly, okay. So which means I should have done spleen 9 on both sides, but okay. So she does show sacrum pain. So again, we can say possibly hormonal, okay?
Do you see what I mean about the sacrum, Avi?
It's
a little bit, yeah.
Yeah. It's, it's puffy mushy. No, I mean, yeah, I mean, it happens. I mean, you would expect that kind of sacrum more with someone who's a lot bigger. I mean, she has more padding on the sacrum than you would have expected given how thin she is elsewhere. So, but that's some sort of protection that happened there, I'm assuming. All right. So, discomfort here and discomfort here, right?
Yeah.
Okay. How is this area?
Uncomfortable.
Uncomfortable still?
Yeah.
All right. So, you said the left side is worse, right?
It's
So you have here, yeah, and this,
Sorry.
okay. Hold on, give me a second. How's now?
It's still quite tender.
I can't hear you speaking too loud.
Sorry, it's still quite tender.
Still quite tender, okay.
Yeah.
Hold on. Now,
Yeah, that feels a bit better.
how much is a bit?
40%.
40%, okay. And how's this one?
No, not really.
No, okay. Heart of soul, if you take, well, she's supposed to be bending loose. Yeah, bending. Kidney one is here. Pull yourself here to the edge. That's we call heart of soul. Okay, some people say that's kidney one, they're wrong. Okay, my opinion, they're wrong. Okay, kidney one's a little lower, so it's about a tsun distal to kidney one. Very good point for spinal issues. Okay, that didn't work for her, so that's okay. We'll find something else that will.
Will you needle that point?
Yes. Oh, you mean as opposed to moxa?
Yes.
You can do both, but yes, I totally needle. That's why I have these kinds of needles. The 0.12 by 15, I can go in anywhere I want on the feet. It's not a big deal. Okay.
Would heart 3 release the L5 and then clear everything round?
Heart 3 releases L5 if it's one-sided.
That's just,
It has to do with one-sided, but look, she is L5 in the center, right? Hi. Yes?
Sorry.
No, it's okay.
It's not too bad there. It's more to the left.
Hmm?
It's not too bad there. It's more to the left.
Okay. No, there was this one
Yes.
that you didn't like, but that's not L5. I mean, I know it's not so relevant for you. This is different, but I'm talking about,
Yes.
because you did,
Yes.
this,
Yes.
okay, this is center. Okay. This area is okay, correct?
Yes. It's okay at the moment.
I mean, no, in general, you don't have pain. You have pain from here
Sometimes.
above?
Sometimes I do, right, it can be different spots in my back. It just varies.
Okay.
But the bottom and the top are the worst, basically.
Okay. Pain here?
Yes.
How's now?
Yes, that's improved.
By how much?
60%.
And now?
Yes, better than the other side.
Okay. And how about here?
Yes,
Okay. How about this?
yes,
Yes, good?
yes.
Yes. Okay. This point is about 2 fingers or so below UB36. For some people, okay, these are very good for back pain. It's not my first choice, but for some people they can be incredibly important because they basically balance, they undo the pull that the hamstring has on the back.
They undo
what? The pull that the hamstring has on the back. Oh. So now, basically, one of the problems is she says she can have pain everywhere in the back, which means I don't want to needle anywhere on the back because I don't needle into pain. That's okay. Not a problem.
Would you ever moxa replace that's sort of painful that you'd like to needle instead, or is that still?
Maybe. Not my first choice. My first choice is stay the hell away, with the exception of diet drinks and aluminum foil. That I'm willing, because aluminum foil pulls inflammation out. But generally speaking, I don't, besides prodding the place, which is bad enough already, in terms of needles and stuff, Asha is just not my, when it comes to local treatments, if it's not, my language for local treatment would be diet rings, chains, aluminum foil. If you want cupping, that kind of, washa, all of that is fine. But needle, anything penetrates the skin, and to some extent moxa, well, actually washa penetrates below the skin because you can see there's a, moxa to me is like needle. I don't distinguish in that way.
Would you ask then if she sort of tends to find would you tend to find they think they have tight hamstrings? They'd notice that when this point helps their lower back.
No, because, she clearly does not have tight hamstrings.
But
It's
her
an
problem isn't
imbalance.
forward bending, actually, I think. Is that right, Anita? It's like bending forward, you would feel your...
She said bending in any direction.
Like bending forward, you'd feel your back, don't
Yeah,
you?
yeah,
So it's a
definitely.
Because
sort of
also
more
can it not
hamstring
be that
action.
one area is very hypermobile and other areas become very tight. and
Yes,
compressed,
it can
so
be.
it
No,
could
it
have-
can, but I would, okay, you can, she does not have a tight hamstring. It's just, it's the way, it's not about tightness, it's about how they operate. So, does that make sense?
Yeah,
No.
but then needling them, what are you doing?
You're re-educating how they're communicating with the back, or you're hoping you're re-educating. Hold on one second. How is this now?
Not too bad.
Not too bad, some still left. Okay.
Yeah.
No, that's okay. And if you look up, if you lift your head, is there any pain? Because you said that's one of the things. If you come down.
It's not too bad. It's worse down here than anywhere else.
When
but
you do
it's-
that?
Yeah, but it's not too
Okay,
bad.
okay. So when you lift your head, you feel this.
Yeah.
So she's compressing L5. Okay, fine. Is this okay?
Yeah, not too bad.
Okay. Sacroiliac ligaments, very important for
That's
me.
quite tender.
This one,
Yeah, both. Yeah,
both.
yeah, both sides.
Oh, wait, because I thought this side was okay.
It's
Other
worse
ones-
on the right.
Okay. How about this?
That's not very nice.
Okay, okay, just for 1 second. Would you lift your head again? How's that?
That's not very nice.
No, okay, no, okay, gotcha. She definitely has a valley back. Remember, I told you valley back is either adrenal or endocrine, so she indicates the endocrine. How is this now here?
Not too bad.
Okay. And this one?
That's okay.
And here? No, here, and, okay. I know I'm touching you, but I'm not gonna push you down.
Yeah,
Go
yeah.
ahead and lift your head.
That's okay. That's all right.
Can you lift more? How is it?
It's
Good.
okay.
Okay, good, let go. So she's back to endocrine. I mean, she was endocrine, it wasn't like we took her out, but because I can't do anything on the spine, I'm gonna just concentrate on that.
What was that point?
Small intestine 13. Remember small intestine 13 relates to pituitary? Are you okay?
Yeah, that's quite painful, that one.
The needle?
Yeah,
Sorry.
that's okay.
How's now?
Yes, a little bit better.
It's better?
Yeah.
Okay, sorry about that. Oh, I see, because of the shirt. I see what happened. Okay, sorry about that. Okay. How's these guys now? Before I did this. How is it now?
Yeah, that's better.
Okay,
Yeah.
so now I can needle those. You know, it's not the sacrum that's weird, it's the ilium. That's weird. It's kind of like, it's almost like it's hyper curved. You know, the ilium usually comes and curves a little bit this way, and hers like. Okay?
Yeah.
But yeah, it's like you said, there's something structurally, like when you look at the rest of the body, that just doesn't quite fit there
Yeah.
in that
So
area.
lift your head once again. How are you doing?
That's fine.
Okay, right.
Thank you.
Thank you.
That was a painful area, wasn't it?
But it got released with small intestine 13. If there's nothing there, I can needle it. Sacroiliac ligaments are best for L5. This is good now?
Yes.
Okay. And best for when they lift their head and they say pain. That's when sacroiliac ligaments are really good. Okay. Any other questions? Yes.
Does bladder 40 feature much in your style? Do you need that?
It doesn't feature at all. Got it. We have a combination that's called Ihikon. Okay. UB60, 58, so-called 40, but it's not 40. That 40, for me, it's actually UB39, and I needle it towards the fossa, the popliteal fossa. For Kiiko, I'm sorry, for me it's 38, okay, above the crease of the knee. For Kiiko, it's 39 basically, so it's lateral to UB40. So UB40 itself does not feature at all. Ihikon we use for things that start with a fever, we use for head injuries. But yeah, UB40, okay. UB40 is useful for back pain when there is a congestion of vessels. Okay, then it's a useful point, and actually that you're better off bleeding it anyway. Now, if you want things around UB40 that are going to be useful for back pain, look for the attachment of the hamstring here. Okay, that can be very helpful for back pain. Okay, so again, it has to do with how are you educating the hamstring to propel the gait upwards.
You needle into that attachment?
Yeah, yeah.
So, sorry, where and how do you needle that?
Take gallbladder 34, come back. So you're below bladder 39. I needle straight in.
Straight in.
And this is one of those points you're going to have to palpate on people, and you know, like when they say, "Oh yes, that's good," and then you'll get a feel for it. There's a certain ropiness to it. So there's no way to quite describe what happens there. You know, every point has its feel. You know, and you kind of like develop. You know, no, and that's why most people use 10 to 20 points altogether. You know, it's like I'm not different. You know, it's like, you know, Sanjo 8, kidney 7, blah, blah, it's all the same. You know, it's just the combinations are a little different. But because, you know, it's hard to like really get acquainted and have an intimate relationship with 360 whatever points there are, right? So, any other questions?
You mentioned some bloodletting. How much do you do and what?
Depends on who you are.
cases?
If you're
Yeah.
Miriam Lee, she had people stand like this. She had a sink. And no, the buckets I haven't seen. I haven't seen the buckets. It was before my time.
I do, not with the bucket. I do.
Yeah, and she just jabbed, and she would have paper towels everywhere, and the amount of blood that came out was just like, I nearly fainted. I mean, let alone the poor patient. I don't know what the patient thought. The patient said, "Wow, the back feels better," but I was like, I'm never doing this under any circumstances. You know, it's like, whoa. I mean, there was.
Gushing.
I mean, it was gushing. I mean, it was like unfucking you know, it's like, but you know, it was kind of funny because by that time when I studied with Miriam, I was 91. she was already beyond the bleeding period, kind of thing. Well, I didn't mean it that way, but you know, maybe that's what it was, I don't know. But anyway, she wasn't, you know, bleeding was not huge on her thing, because people who studied with her 5-6 years before me are the big bleeders. You know, she went to China and she studied with someone who all that woman did was bleeding. Okay, that woman didn't needle, she didn't do moxa, she didn't do anything. Miriam was the kind of person where she would go somewhere and she would study with someone and she would take it wholeheartedly and try it on absolutely everyone. She would see 40 people in like a few hours, and you know, it's kind of like everybody got this. She had 9 beds, she would fill them in an hour. Everybody would come at 9 o'clock, she would treat them in like 15 minutes she was done treating those 9 people, and at 9:45, she would pull the curtains open. It was like a room, it was half this size, it was, that's generous, okay, with 9 beds, somehow, I don't know how, and there was barely any space to walk between the beds. And she would pull the curtains open, pull the needles out by, you know, say 10 to 10, everything, you know, because she gave me 45 minutes, so by 5 to 10, everything was done. New batch came in at 10 o'clock, they all came in at 10 o'clock. Started, and often she would do the same exact thing. Every so often she would change, but if she was interested in a certain combination, everybody got it. They needed it, they didn't need it, it didn't matter. You know. So by the time I was with her, she wasn't really bleeding. But there was this one, so that's one of those cases where, you know, she suddenly goes, oh, this is, you know, like, I want to, you know, this is unique. So she called me. She said, come see, because she knew that I've never seen anything like this, and you know, and you know, she had the woman kind of stretch out before you by leaning forward, and that, yeah, the woman had like really dark varicosity, and she just, you know, she didn't use a lancet. She used like these, you know, I've only heard of these things, these three whatever, yeah. Prisoned, you know, it's like, is this something you go hunting with? It's like, what the hell? It was just amazing. And the woman claimed that, you know, she said, wow, so much better. I'm like, yeah, but it's like, okay, Count Dracula. It's like, not like that.
Marion Fixer, on the other hand, has 1 drop of, well, no, she says do it until the blood becomes red.
Yeah, well, yeah, but when somebody, okay, hold on. Yes, that's what Miriam said also. However, this point is effective, this point is effective when there's a lot of stagnant blood there. Therefore, you have to bleed that much, okay? If somebody, you put two drops, and you know, and it becomes regular blood, chances are it's not going to do the back pain. I mean, that's, you know, like I really don't bleed at all. When I did any kind of bleeding, it was with 7-star. I've done lanceting, like when I came out of school, I've done it maybe a few times, you know, the first year, and I've never really done it since. I have done more like 7 stars, in which case all you get is like a little, it's not even a droplet of blood. I mean, it's a different kind of bleeding, and that can be also very helpful.
What do you use it for then, the 7-star?
Well, if they have, a lot of people have varicosity around here or around Q3, and you tap until you get, you know, you can actually, instead of looking for blood, I take alkalized cotton ball, and I tap boom, 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 and I you know, and when the alcohol, the cotton ball, you know, so I tap, 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 and then I just go over the area, and if I see a little brownish spot, because I wouldn't see the blood, but if the cotton ball has a little, that's the end, you don't need to do anymore. You know, so all the patient feels is like, it's like shonishi. You know, so they just feel like this, they don't mind.
More painful than shonishi, no?
Depends on what your 7-star needle is made of, and you know, like, no, 7-star, okay. A 7-star needle should be bounced. in the way I was taught to do it. You just, yeah, but it's not this. It's very light. It shouldn't really be, I mean, people feel it. Okay, it's not, because, you know, it's like, listen, you feel this, right?
Yeah.
Of course you feel, you know, it's impossible to tap someone, you know, and they're not feeling it, okay? But it's not, you know, the 7-star, I mean, I don't have one, but it's not sharp. I mean, there's sharpness, but it's not like a knife or anything. So they feel it. It's kind of slightly annoying, but it's not, I wouldn't call it pain, you know.
Do you use it for people with like numbness and on the numbed area?
No, you could. I understand but I don't. What I do in numb areas is I use diodrates and aluminum foil and stuff. But numbness as a category belongs to spleen 3 and lung 8. Okay. According to Magidoff, numbness means, you know, like diabetics get numb. Okay. Numbness means the blood is too thick and not oxygenated enough. So it's too thick, that's why we use spleen 3, we use for diabetic for sugar. Okay, too much sugar in the blood is too thick, then you want to oxygenate it with lung 8.
That makes sense.
Okay, let's see how you're doing. Okay, let's have you sit up when you're ready. And test out your back and neck. It's okay, take your time, take your time.
My neck still feels quite tight, but it's
Your neck still,
it's not,
okay.
yeah, but it's not so painful. No.
Okay, and the lower back?
This is on camera, and it's.
Yeah, it's good. Yeah.
Okay, so the neck still feels tight.
Yeah.
Okay, hold on 1 second. Lie down, face up. Anything here? It's okay. So scalings. How's now? How much? 80%. Okay, hold on. This is where press stacks are very convenient. Because at the end they go, oh, by the way, I still have blah, 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 blah. It's like, okay, let's see. Lung 8. Basically, scalings is treated very much like numbness. How's that? Okay. One, two, three. 2 and 3. Relax now. 3, 2. Stand up and tell me how it feels.
Yeah, that's better.
How much is left?
That's good.
It's good?
Yeah.
No tightness?
Yeah, no,
You sure?
yeah. Yeah, there's more on the next side.
Oh, that's interesting because the right side was tighter.
Yeah, I
So,
know,
it's
yeah, it's
interesting.
that side, but it's this side that's good.
Yeah, so it's
Yeah,
good?
better.
All right, let me just put a little extra tape on that so it doesn't fall off easily.
Did you do that over spleen 3 because of the location?
No, I was going to add spleen 3. It was just easier for me to test lung 8. And so since it was done, you know, we were okay. Hold on, I need to open
Do you want
this.
nails?
Do I want nails?
Go on then.
I may, yes, go for it.
I mean, what about the scar? Would you treat her scar at all?
She didn't have any pain on it.
No.
Thank you.
It was very dead when it first happened anyway, but
Do I just leave them alone?
Leave them alone, they'll fall on their own. You can wash your hands, you can do whatever, take showers, whatever you want. They fall, they fall. They don't fall, they don't fall. I believe that in 3 days they'll disappear. If they annoy you, rip them out. Okay?
Yeah,
All right, thank you for
yeah,
coming.
very nice to meet you.
You
Thank
too. Thank you.
Very much. Thank you.
Thank you.
All right, any questions? Batting eyelashes does not constitute a question.
Yes, I wanted to ask you if you go back to my question of bleeding, if you ever
Of what?
bleeding, if you ever bleed the you know people that have this redness around bladder 10?
Yeah, I don't exactly know what it means or what its significance is, and I don't know I have to write
No.
it.
Okay.
Yeah.
And you don't have an interpretation?
I
No.
do not have any, I mean, people asked me about this before, and I've seen it every so often. It doesn't, I don't have any resonance, it doesn't bother me maybe, I don't know. I don't know, I'm sorry. I mean, do you find it on anything?
A lot of, I find it on loads of people, but I've seen it bleeding it too, and I wanted to ask you if you could.
You've seen bleeding it and what
I've
does it do?
seen
It
a
be
Japanese
red.
teacher bleeding it with a cup as well, so I wanted to know.
And what was the purpose?
Taking any tension on the back, anywhere on the back, anywhere in the bladder channel really actually.
And it just looks red, it's not puffy.
Well, could be puffy, but mainly it's this mark of redness, almost like a birthmark, but it's not a birthmark, it's almost like
Well,
a
I've seen it, it looks like it got rubbed, but it's usually partially in the hairline, right?
Yes,
Talk about that.
bladder 10 area.
Yeah. I haven't seen it, haven't done it. I mean, can you, look, if you like bleeding, you like that stuff, go for it. I personally, it's like, certain things I don't do because they're really inconvenient. So for example, bleeding with cups. Yeah, exactly. You know, it's like I have enough dishes to wash in my life. I don't need extra.
Yeah.
No, not my favorite thing to do. No, because it's not washing. I mean, you have to sterilize the fucking
Yeah.
cup after.
No, I mean, I don't do bleeding with cups, but for example, I wanted to know
Yeah, no,
what
no,
you do with bleeding, if you do any Jing-Well points.
I generally know.
No.
What Kiiko says is, for example, for cough, so she says, you needle small intestine 1, and when you take the needle out, you hope that blood comes out.
Okay.
You hope, supposedly, right? So that kind of, you know, I don't do it, so I can't say. But yeah, the other thing, for example, I don't do because of convenience is Kyotoshin, because Kyotoshin for me, it stinks like hell, and I can't stand it, you know, so I just, you know. Kyotoshin is
Moxa on a needle.
Moxa on a needle, and so it really, you know, so when you press and inside the body feels very cold, Kyotoshin is very good. And Kawai used Kyotoshin on every single needle. He never needled scalp, ear, body, doesn't matter. Every needle, if it had a needle, it had Moxa on top. It's a kind of, you know. So when Kiiko and I brought him in 2000, he came to the States, and we had it, you know, he did one class in San Francisco and one class in Boston, and then afterwards we were both, you know, I had to try, right, you know, and I was like, no, after 3 weeks, I was like, no fucking way, never touched. 16 years later, I have not touched Kyotoshin.
Not even smokeless.
Not even anything, I don't do it. I just rebelled, and it's like, block, I have a block against Kyotoshin. I will not do it under any circumstance. I know that they have these things that you hang on, the OMS sells them. They're actually quite expensive. I even bought it. You know, then you have to stand around until the Moxa is over in case it falls, blah, 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 blah. Not my thing. Just like bleeding, it's not my thing. It's like, you know, just like drugs are not, you know, I don't prescribe drugs to people. You know, it's not what I do. You know, everybody's got limitations. You know, I can't do everything.
You can use a TDP lamp instead, can't you? Seems to
Not
work
for
well.
that. It's something. TDP is how much it penetrates is, what I do is, I told you, I take a sock, I put agricultural corn in it, put it in the microwave, and put it on the area. That penetrates. But the TDP lamp will get, like a few millimeters down. TDP lamps are very nice.
Yeah,
They feel very dissolving, but the heat, I don't think penetrates that,
It's one of the Kyokushin moxa. I've never found that it actually really seems to warm as well as, like they say something else like a heat pack, a heat lamp, or.
No, I think it does. I think, it depends on what are you using for Kyokushin?
I think probably recently the stuff Andy's sold.
I don't know what he sells, so I can't say.
It looks like the Chinese, just the standard,
Yeah, so it looks like a little cigarella or something that was cut. Yeah, that bullshit. No, seriously, that's actually the smokeless stuff is much warmer than the really expensive stuff that comes. Like it's a metally thing that you put on the needle, and supposed you don't have to watch it, and then they have like this charcoal thing. That's way warmer than this El Cheapo. Well, actually, it's not so El Cheapo, but it's useless as far as I understand. What Kawhi used, his wife he would needle and his wife would follow him like this, and then no. Then can I have the glass? With a glass of water, there was water in the glass, and she comes with a wet cloth, and as soon as the smoke is mostly out, but there's still embers, she goes into the water like this. This is how they worked. Okay, so his moxa was, there was a big glob, and it was the moxa. I believe because I know what Kiiko used to sell. So I think it's kind of brownish, but it's not like the strong. It's not that green. It's not the same color. It's not as strong a color as the Chinese moxa, right? If anything, what I would do is cut a Chinese moxa stick. For that method where you're really looking for heat, go Chinese. Take a moxa, one of those cigars rolled, and cut them yourself. Because the stuff, I don't know if this is really what Andy, but it's some sort of Korean moxa that's sort of like a hybrid. It's not gold, but it's not really rough like the Chinese. You're looking for the heat, you're looking for the rough. So go, just use that if you want to use it. But I would pay the little bit of extra money, and if you really like it, and do those metally things with a charcoal.
Or corn in the microwave. Corn in the microwave.
Honestly, corn in the microwave is so much easier.
What is agricultural corn?
Sorry?
What is
corn. The corn that you eat pops. If you put it in the microwave, it will pop. Okay, but there's a corn. It's bigger. And it's harder, and if you put it in the microwave, it doesn't pop.
How long do you keep it?
We use wheat.
I do wheat.
In the microwave?
You can do wheat or flax seeds, or you can do rice. I find that corn is best. The reason why corn is dry, for one thing, it's not going to produce a damp heat sort of thing. No, which can be a very good thing. People, there's physiotherapists, But the other thing about corn is it lasts the longest of all the grains. The heat, it's not as hot at the beginning. Rice is a lot hotter at the beginning, but it's a wetter heat, it's a moist heat. But rice loses the heat very fast. Corn will keep, so often what I do in the winter is I take one of those socks, I put it in the microwave, put it in the blanket. Then after the patient's is done, I take the heating pad, so to speak, was inside the blanket. I take the blanket and put it on the patient, and then put the thing under the blanket on the patient. When I come back 20 minutes later, it's still the sock is still totally warm. And then when I come back again 20 minutes later, there's still warmth in the sock. It still keeps them warm. It's not as hot, granted. Okay, so corn keeps the heat. So if you did that with rice, you won't be able to use the same sock after 20 minutes. So what I find is that corn is not as hot at the beginning, but it keeps the heat much more for much
So
longer
you put
time.
what, like a half a kilogram of, like a bag?
You take a sock. You take a sock, you take a cup, fill it with the corn, put the cup inside and spill it, because if you try to spill it from here, it will spill outside, okay? Usually about 3 cups easily. Tie up the sock. And now this is puffy, big puffy.
Yeah.
This goes in the microwave 5 minutes, okay? And you can keep using same sock for months. You know, and then some patients go, it smells like corn muffins.
But how many socks do you need?
Depending on how many patients you see. I keep 2 per treatment, I like to have 2.
Per treatment, 2.
Well, because, I mean, doesn't mean I use it, but you know, first of all, in the winter, every patient automatically gets 1, just to keep them warm. So I have it in the blanket, because I also cover patients, you know, in the winter. So I put it, you know, while I'm checking, you know, the blanket is waiting with a heat pack. When I'm done, they get covered and the heat pack goes on it. Now, if there was a situation, this will be in the back, if I'm more than sometimes in the front. If I want to do Q-Toshin, if I was going to do Q-Toshin, I just take that pack and put it on them. Someone that was very cold, you know, or has freezing toes, I do another pack for them and put it between their feet. So, yeah, it's very convenient for me. So, but you know, it's like other people will do, well, the thing about hydroculators is that they don't have small, you know, you can't do a teeny amount for an hydroculator pack. So,
I think that's lunch.
lunch. Let's come back a little bit before 2 if we can. We have to do calm.